you all so much for being here with us today. We really appreciate your time and commitment to share these special anniversaries with us. It's a real pleasure to get a chance to look out into this audience and see friends, supporters, partners, and the diversity in this room that really is the foundation for all we do. I'd like to also in advance thank Mayor Walsh, who'll be here shortly, Mrs. Kennedy, for always championing the issue of community health and equity in partnership with the late Senator Kennedy, and our keynote speaker, Garth Graham, for his leadership in these areas. Again, thank you all for being here today, for supporting our work in this celebration. Peter, I want to particularly thank you for your introduction, and more importantly, I'd like to thank you for your leadership and support. As you mentioned, more than 10 years ago, upon the release of the Institute of Medicine report, Unequal Treatment, which really documented that minority patients, even with the same level of socioeconomic status, education, and insurance, may receive lower quality care when seen at hospitals across the country than their white counterparts. You and our hospital, under your leadership, decided to take action. As opposed to saying, not us, that doesn't happen here, you were courageous enough to say, why not us? It can happen anywhere. You formed the MPH Disparities Committee, a multidisciplinary group of leaders from multiple departments, which I have the pleasure of co-chairing with my dear friend, colleague, and partner here today, Joan Quinlan. And you made it clear that there was enough time spent diagnosing the problem, but not enough effort spent solving the problem. We charted the path together, and we're here to celebrate that progress today. Again, Peter, you wanted action, and MGH leadership, doctors, nurses, and staff mobilized to ensure that anyone who enters our doors, no matter who they are or where they are from, gets the best we have to offer every day. We set upon a path to strengthen the way we collect race, ethnicity, language, and education disability data from our patients. Under the leadership of Liz Moore and others from the Center for Quality and Safety, we developed the nation's first and best disparities dashboard, now an annual report on healthcare quality and equity, which monitors our clinical performance in the area of equity and serves as a model for others across the country. We develop interventions to address disparities in diabetes and colorectal cancer screening with our wonderful partners in Chelsea and Revere. Patient experience, patient safety for limited English proficient patients. And we're very proud to say we've achieved significant results in all these areas. Altogether, we have made MGH a beacon for what an organization committed to equity can do, not just give lip service to. As we began this journey, the Disparities Solutions Center was founded as well within the Monmouth Institute for Health Policy. Our vision was to be the action arm for all this work, to work in collaboration with others here to make MGH the best hospital in the country in this area and to create a national movement. A movement that would energize, inform, and challenge others to march with us on the path towards improving quality and achieving equity. We've been fortunate enough to have so many wonderful partners here at MGH who have helped make this a reality. And yes, Peter, we made this vision a reality at MGH as we received the American Hospital Association's first Equity of Care Award for all this work just last year. So thank you. Our center, relatively small but nimble, has helped guide this work, as I described, and we're so proud of this. We've developed guides for hospitals on how they can take action in this area. We've actively translated research into policy and practice by disseminating this information to over 5,000 individuals on our listserv, to disseminating information via our web seminars, routinely participated by over 500 individuals, healthcare leaders from across the country and across the globe. We've tried to educate the MGH community by developing seminars and other opportunities. And we've worked with anyone, government, foundations, private industry, hospitals, health plans, health centers, who share our goals, principles, and values. We couldn't have done this without all our supporters and partners. Way too many to name here in the 5 minutes I've been given. But to all of you, I say, from the bottom of my heart, thank you so much. Thank you for your support, and we appreciate your continued support in the next 10 years. I'd like to especially thank those who have worked at the Disparities Solutions Center over the years, as well as my current team that include Alex Green, Lenny Lopez, Robert King, Alden Landry, Carrie Kentz, Adriana Lopera, Andrew Madu, Brian Dennis, and most especially our Deputy Director, Sweeta Tam McGrory, for her absolutely incredible leadership. If we could give her an applause. By personally thanking my mother, Luz Betancourt, who is here today, and my late father, Joseph Betancourt, for planting in me the seeds of caring for the most vulnerable among us, providing a voice to the voiceless, and being a champion of social justice. I'd also like to thank my sister, Jennifer Betancourt, and her husband, Will Rosales, for their incredible support And most importantly, I'd like to dedicate the first 10 years and hopefully the next 10 years of the Disparities Solution Center to my children, Anna and Joey, who mean everything to me and motivate me every day to make this world a better place for them and for our future. The journey continues. It's with humility that I look forward to our progress. And I say that often as we work with our partners, we don't have the solutions, but we find them together. We've taken action locally, and what you're about to see is the national movement we've created. Our crown jewel, the Disparities Leadership Program, which began in 2007, has allowed us to use our platform at MPH to transform this work across the nation. This is a dream come true for us. This is our testimonial. Thank you so much for coming.